We trust doctors with our lives, right? But have you ever really stopped to think about it? How do we actually know that they're ready for that incredible responsibility? Well, today, we're pulling back the curtain on the rigorous science behind that white coat. Let's jump in. I mean, it's a massive question. The trust we place in our doctors is immense. But here's the thing. That trust isn't just a leap of faith. It's built on a surprisingly complex and evidence-based system, one that's designed from the ground up to prove competence. And how it works is probably not what you think. So if you're picturing one giant make-or-break final exam, you can just throw that idea out the window. The reality is way more sophisticated. The best way to think about it is as a journey, a carefully designed climb up a pyramid where you have to master each level before you can even attempt the next. Now, before we start that climb, we have to understand the why behind all this testing. Because it turns out not all tests are created equal. They actually serve two very different purposes. Is a test designed to help someone learn, or is it there to pass a final judgment? This slide really lays it out perfectly. On one hand, you have formative assessment. The best way to think of this is like coaching during practice. It's low stakes, it's all about giving feedback, and it's designed to help you get better. It's an assessment for learning. Then, on the other side, you have summative assessment. This is the championship game. This is the final exam, the board certification. It is high stakes, and its entire purpose is to be a final judgment of your learning. A subtle difference in words, but a massive difference in purpose. Okay, so keeping those two ideas in mind, learning versus judging, let's get back to our pyramid. And this isn't just some nice metaphor. It's a real, established framework that guides medical education all around the world. It's called Miller's Pyramid. It was developed back in 1990, and it gives us this incredibly powerful way to map out a doctor's progress. It organizes all their skills into a clear hierarchy, starting with the stuff you learn in books, and climbing all the way to effective action in a chaotic, real-world clinic. And here are the 4 levels we're going to be climbing today. It starts at the very bottom with knows, just the basic facts. Then you move up to knows how. Can you apply those facts to a problem? From there, it's shows how. Can you actually demonstrate a skill? And finally, you reach the peak of the pyramid, does. Can you do it all in the real world when it really counts? All right, time to begin the climb. We're going to break down each level of this pyramid and look at exactly how educators measure competence every single step of the way, from the classroom to the clinic. We start at the base. Knows. This is the foundation. This is pure factual knowledge. Can you recall the names of the cranial nerves? Do you know the correct dosage for a specific drug? This is tested with all the tools we're familiar with from school. Multiple choice questions, written exams. It's all about making sure that essential information is locked in. But just knowing facts is not enough, not even close. Welcome to level 2, knows how. This is where it gets way more complex. It's not enough to just regurgitate facts. You have to be able to apply them. This level assesses clinical reasoning. The question shifts from what is the symptom to a patient has these symptoms, so what's your diagnosis? This is where those tricky, case-based problems become absolutely critical. Level 3, shows how, is a huge leap. We're jumping from paper to practice. Can you actually perform the skills you've learned about? This is tested in controlled settings, using high-tech simulations, and most famously, a special kind of test called an OSCE.
So what in the world is an OSCE? Well, imagine a series of practical, high-stakes pop quizzes. A student moves through a circuit of different rooms, or stations. In each one, they face a unique scenario, often with a trained actor who is incredibly convincing as a patient. They might have to take a medical history, explain a tough diagnosis, or perform a physical exam, all while being scored against a very detailed objective checklist. It's all about proving you can do it, not just talk about it.
And all of that brings us to the very peak of the pyramid, does. This is the ultimate test. It's one thing to perform in a simulation, but how do you handle the messy, unpredictable reality of a hospital with real patients and real, unexpected problems? This is where workplace-based assessments come in. You can think of these less like a final exam and more like a driving test with an instructor who's always in the car. A senior doctor observes a trainee during their actual normal workday and gives them structured feedback right there on the spot. The assessment is literally baked right into the job. And they've got a whole toolkit for this. An observer might watch a whole patient visit from the first hello to the final diagnosis. That's a mini-sex. Or they might zoom in on one specific procedure, like inserting an IV. They even have these deep dive discussions about past cases to really probe the trainee's reasoning. The names aren't that important. What is important is this culture of constant observation and feedback out in the wild.
Okay, so let's zoom out. All of these different tools, from the basic MCQs all the way to these on-the-job check-ins, they're all part of a massive philosophical shift in how we actually train doctors today.
It's called competency-based medical education, or CBME. Now, the old model was pretty simple. You spend X years in school, Y years in residency, and poof, you're done. CBME totally flips that script. It says time isn't what matters most. Ability is what matters. You only progress to the next stage when you can actually prove with observable evidence that you can do the job.
Okay, so we've seen all these different tests and frameworks, but that raises another pretty important question. How do we know if the tests themselves are any good?
Turns out, there's a kind of utility formula for that. A good test has to check 4 boxes. Is it reliable? Meaning, will it give you the same results over and over? Is it valid? Does it actually measure what it's supposed to, like being a good doctor or just being good at tests? Is it feasible? Can we actually do it in the real world without breaking the bank? And maybe the most important question of all, does it have a positive educational impact? Because if the test doesn't actually help students learn, you have to wonder what its real value is.
So where is all of this going? Well, this field is constantly evolving, and technology is on the verge of completely revolutionizing how we assess the doctors of tomorrow.
And the future is basically already here. Imagine artificial intelligence that can give instant, unbiased feedback on a surgical technique, or virtual reality that lets a trainee manage a high-stakes emergency with zero risk to a real patient. We're moving toward a world of constant, data-driven feedback and personalized learning paths for every single student. And that really just sums up the whole journey we've been on. The goal is to move away from just memorization and move toward assessments that are more authentic to the real job and more supportive in the mission of building better doctors for all of us.
Which leaves us with a final thought. We've built this incredible system to assess the doctors of today, but medicine is changing at lightning speed. It's more complex, more team-based, more driven by technology than ever before. So what skills will we need to measure tomorrow? And how will our very definition of what makes a great doctor continue to evolve?